Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Behavioral activation reduces suicidal ideation in women with perinatal depression. Suicide remains a leading cause of maternal death in the perinatal period. Despite its urgency, there are currently no interventions specifically designed to reduce suicidal ideation, SI, and behavior among pregnant and postpartum women. Standard clinical practice focuses on treating underlying conditions like depression, anxiety, or psychosis, but whether this adequately addresses suicide risk is unclear. Greater than a new study published in JAMA Psychiatry examined how suicidal ideation changed in women receiving a brief behavioral activation (BA) intervention for perinatal depression. What is behavioral activation? Behavioral activation is a structured, evidence-based psychotherapy that helps individuals identify patterns of avoidance and inactivity that worsen depression. The treatment emphasizes engaging in activities that provide a sense of meaning, mastery, and reconnection to personal values. For perinatal women, this can include re-establishing daily routines, increasing social support, and reconnecting with meaningful roles at a time when depressive symptoms may feel overwhelming. BA is considered a first-line psychotherapy for perinatal depression and can be delivered effectively in brief formats. Overview of the SUMMIT trial. The current study is a secondary analysis of data from the SUMMIT, Scaling Up Maternal Mental Health Care by Increasing Access to Treatment, trial, a large 4-arm, non-inferiority randomized controlled trial conducted across 5 academic health networks in Chicago, Illinois, Chapel Hill, North Carolina, and Toronto, Ontario. Eligible participants were pregnant women up to 36 weeks gestation or postpartum women 4 to 30 weeks after delivery presenting with depressive symptoms, defined as an Edinburgh Postnatal Depression Scale, EPDS, score of 10 or higher. Participants were randomized to one of 4 treatment arms. Specialists, psychiatrists, psychologists, social workers, delivering BA in person and NBSP, specialists delivering BA via telemedicine and NBSP, non-specialists, nurses, midwives, doulas, delivering BA in person and NBSP, non-specialists delivering BA via telemedicine and NBSP. Each participant received 68 weekly individual BA sessions according to a structured, manualized protocol. Suicidal ideation was assessed using EPDS item 10, in the past 7 days, the thought of harming myself has occurred to me, scored 03, where higher scores indicate more frequent SI. Results greater than a total of 1,230 women enrolled, and 1,117 completed at least one BA session. The mean age was 33.4 years. During treatment, 264 participants, 23.6%, reported suicidal ideation. These individuals were more likely to be younger, to report more severe trauma symptoms at gasoline, and to have a history of depression or anxiety compared with those who did not experience SI. Key findings included: with each additional BA session, the odds of reporting SI decreased by 25%, or 0.75, 95% C, 0.580.96. And NBSP, at 3 months post-randomization, the odds of endorsing SI had decreased by 80%, or 0.20, 95% C, 0.140.27, p.001. And NBSP, reductions in SI did not vary by clinician type, specialist versus non-specialist, or delivery mode, in-person versus telemedicine. And NBSP notably, 10 participants, 0.9%, did not show reductions in SI or reported worsening SI during later sessions. These individuals tended to be postpartum and had higher trauma and depressive symptoms. And NBSP and NBSP and NBSP. Key considerations and future directions. The current study demonstrates that a brief behavioral activation intervention significantly reduces suicidal ideation among perinatal women with depressive symptoms. Importantly, the effectiveness of BA was independent of whether the intervention was delivered by specialists or non-specialists, and whether sessions occurred in person or via telehealth. This suggests that BA is a scalable and accessible intervention that could expand access to evidence-based care at a time when mental health resources for perinatal women remain limited. In addition to reducing depressive symptoms, BA may mitigate suicide risk by increasing engagement in meaningful activities, reducing withdrawal and avoidance, and alleviating hopelessness through connection to personal values. Even in a relatively brief intervention, BA addresses many treatment priorities reported by women experiencing suicidal thoughts. While participants were selected to participate in this study based on elevated EPDS scores, this measure is not diagnostic. Some women may have had bipolar or anxiety disorders rather than unipolar depression, raising questions about whether BA is effective across different diagnostic groups. Additionally, some women continued to report SI despite treatment, suggesting that BA may need to be supplemented with other interventions for those with severe or trauma-related psychopathology. It is also important to recognize that SI can emerge independently of depression, particularly in the setting of trauma or substance use disorder. Thus, some individuals may require different interventions specifically targeting suicidality. Future research should examine whether BA is comparably effective to other brief, targeted interventions and whether combined treatment approaches offer greater protection for high-risk subgroups. Rutanonx, MD PhD. References: Kalush PR, Molina, North Carolina; Berenbaum T.S., Dennis C.L., Gaines B.N., Meltzer Brody S., Reyes Rodriguez M.L., Silver R.K., Stubbe M., Vigard S.N., Schiller C.E., Singler Dr. and NBSP, Behavioral Activation for Perinatal Suicide Ideation, Secondary Analysis of a Non-Inferiority Randomized Clinical Trial. And NBSP, JAMA Psychiatry. 2025 August 20th: E252116. And NBSP. Singler and NBSP, Dr., Silver and NBSP, RK, Vigard and NBSP, SN, and NBSP, et al. And NBSP, Task Sharing and Telemedicine Delivery of Psychotherapy to Treat Perinatal Depression, a Pragmatic, Non-Inferiority Randomized Trial. NatMed. 2025, 31-4, 12-14-12-24, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.